Good morning, everybody. My name is Tim Wilson, and with my colleague from the Senate, Louise Pratt, we're the parliamentary co-chairs of the Parliamentary Friends for HIV, STIs and bloodborne viruses. And we would like to welcome you this morning to the 2020 World AIDS Day breakfast. I'd like to begin by acknowledging the traditional custodians of the land in which we meet, the Ngunnawal and Ngambri people, and pay respect to their elders past and present. And of course, World AIDS Day, which comes around the 1st of December every year, is an opportunity, of course, to remember those whose lives have been lost, those who continue to work with people living with HIV as part of the research community, as part of the health community and health response, and of course, those living with HIV today. And every year we normally get together at the World AIDS Breakfast in Parliament House as an opportunity to continue to show the bipartisan spirit and support for which combating the transmission of HIV shares a bipartisan spirit within our federal parliament. And this year is no different, even if we're perhaps doing it by comparative distance. The good side to that is, of course, via Zoom, we're able to do it with many speakers from other community organisations around the world who may not ordinarily be able to be physically present with us. This morning we have a jam-packed conference because this is the hottest ticket in town for a breakfast. We have representatives from the International AIDS Society, the Pacific Friends of Global Health. We have both the Minister and Shadow Minister for Foreign Affairs and the Minister and Shadow Minister for Health, again showing that bipartisan spirit, of course, as well as from Afeo and NAPWHA, and concluding with thanks from my parliamentary co-chair, Louise Pratt. But we begin this morning with an introduction from Michelle Tobin, who's the director of the NAPWHA National HIV Alliance, to acknowledge country. But before I formally introduce her, can I just ask anybody who is on to make sure that they have put their microphones onto mute throughout the breakfast event, of course, unless you're speaking, and you should turn it on when you go and speak, because we want to make sure that people can be heard and we don't have any interference. To start this morning, we have Michelle Tobin, who's an Aboriginal woman of the Yorta Yorta Nation, descendant of the stolen generation. She has lived with HIV for 27 years and sadly lost her husband to HIV and has experienced many levels of stigma and discrimination. Michelle has spent many years working with the HIV Speakers Bureau nationally. She served on several HIV boards and committees at a state and national level. She currently sits on the board of the NAPWHA National HIV Alliance as the HIV positive representative, and is also a community member and the convener of the Positive Aboriginal Torres Strait Islanders Network. She is a member of NAPWHA's Femme Fatales network. At present, she is one of the 2 women across Australia who advocate for Aboriginal and Torres Strait Islander peoples living with HIV. She also represents the positive voice of Aboriginal and Torres Strait Islander peoples, especially for women, on a number of advisory committees, and we welcome the opportunity for her to be able to give the acknowledgement of country.
Thank you, Tim. Good morning to everybody. I'd like to pay my respects to the Gadigal people of the Eora Nation of where I am today. I also like to pay my respects to the Aboriginal lands of where you all come together from today as well. I'd like to acknowledge our elders past and present. Also pay my respects to any of our Aboriginal people that are emerging at this present time. Also to pay my respects to our brothers and sisters that have gone before us. For me, I have been living with HIV for 30 years, and it has been a struggle for Aboriginal people around this country, you know, to have a place at the table where we're acknowledged of what's happening. Unfortunately, a lot of the resources and educational materials that have been developed around the country have not been culturally appropriate. So there's a lot of information that hasn't reached out to our communities to help, you know, stem the high infection rates. And unfortunately, you know, over the last few years, we've seen the rates have doubled compared to non-Indigenous, and as of now, it's still at 2.3%. So there needs to be a lot changed. There needs to be a lot more where people need to come together, work together, and be inclusive of Aboriginal people. And in saying that, I also like to state that sovereignty was never ceded, and it was and always will be Aboriginal land. Thank you.
Thank you very much, Michelle, for that welcome to country this morning. And next, we are very fortunate to be able to have Professor Dr. Adiba Kamarulzaman, who's joining us from Kuala Lumpur this morning. She's the president of the International AIDS Society. Professor Dr. Adiba is currently the president of the International AIDS Society and connections with Australia through graduating from medicine at Monash University in Melbourne. Good university, I might add, since I went there, and receiving training in infectious diseases at the Fairfield Infectious Diseases Hospital in the great state of Victoria. Professor Adiba established the Infectious Diseases Unit at the University Malaya Medical Centre, and in 2007, she established a Centre of Excellence for Research in AIDS at the University of Malaya to develop and enhance HIV/AIDS research activities in Malaysia. She is currently chair of the Malaysian AIDS Foundation, the co-chair of the WHO Strategic and Technical Advisory Committee on HIV, an executive committee member of the International Society of Infectious Diseases, and was recently appointed as a member of the Lancet Commission on Drugs and Health. And we both greatly appreciate your participation this morning, Adiba, particularly in light of the fact that it's slightly earlier, about 3 hours behind where we are in Australia today. Thank you.
Thank you, Tim Wilson, for your introduction and for your leadership of the Australia's Parliamentary Friends group. And thank you, Michelle, for your acknowledgement of country. I would also like to pay my respects to the traditional custodians of the Australian lands in which this event is held, and pay my respects to the elders past, present and future. I want to also acknowledge your parliamentary colleagues who have joined today's breakfast, in particular the Minister for Foreign Affairs, the Shadow Minister for Foreign Affairs, the Minister for Health, the Honourable Greg Hunt, the Shadow Minister for Health, and Senator Louise Pratt. And to also acknowledge my sector colleagues, Professor Brendan Krapp, Felicity Young, and Scott Harlem. Now, as you heard, I trained in medicine at Monash University and in infectious diseases at the Monash Medical Centre, the Austin and Fairfield hospitals, and I feel especially honoured to have been invited to this World AIDS Day event. I actually credit my Australian education in the health system for guiding me and leading me to where I am today. So I'm very, very pleased to be here, even though it's very early in the morning. Now, Australia has long punched way above its weight when it comes to the HIV response. The exemplary leadership that you have shown and the multi-sectoral engagement and commitment has meant that Australia is one of the few countries in the region, if not the world, to achieve the 90-90-90 targets. Universal healthcare, leadership across civil society, patient groups, clinicians, academia, and politics, along with investment in science and research, have been Australia's ingredients for success. Unfortunately, this achievement is not shared by the majority of countries in this region. The truth is, ladies and gentlemen, Asia and the Pacific is currently lagging behind in the global HIV response. And this was even before the COVID pandemic, which, as we all know, has come to disrupt many HIV prevention and treatment services across the region. Although HIV infections in Asia and Pacific have declined by 12%, with reductions particularly seen in Cambodia, Myanmar, Thailand, and Vietnam, this is offset by sharp increases in Pakistan and the Philippines, and even in my own country, Malaysia, where we were doing quite well in the early 2000s, have now seen an increase in infections. Key populations and their partners accounted for an estimated 98% of new HIV infections, and more than 1/4 of new infections were among young people aged 15 to 24 years. However, only about half of key populations living with HIV are aware of their HIV status, and late diagnosis and poor adherence to treatment are common in the region we live in. As you all also know, we have the tools now to bring an end to HIV. Innovations in prevention services such as PrEP has been widely taken up in Australia with tremendous success. Sadly, PrEP programs remain nascent in most countries in Asia Pacific. The long-known effective tool, needle syringe programs and opioid substitution therapy to prevent transmission amongst people who use drugs are still not implemented to scale across the region. And now we're faced with a change in drug use trend with increased use of methamphetamine drugs, which has also been linked to HIV transmission, that calls for a need for innovative harm reduction services. An overall slowing in reductions in new HIV infections coincides with a decline in political and programmatic commitment, alongside punitive laws and policies and rising stigma and discrimination that block effective AIDS responses. Now, the 2020 Global HIV Policy Report that was just released yesterday has shown that law and policy remain a major barrier to halting HIV in this region. What they found was that no country globally has fully adopted core policies aligned with WHO, UNAIDS, and other international standards across 33 issues. No country in our region has aligned even most of its policies on testing, prevention, structural drivers, and health systems. Some of the countries facing the fastest rising new infections and AIDS deaths have adopted the fewest international law and policy recommendations. Conversely, countries that have adopted these international laws and policies, for instance, Thailand, have seen a reduction in new infections. Ladies and gentlemen, the COVID-19 crisis has brought together scientists in an unprecedented global collaboration that has led to major scientific discoveries, treatment advances, and even vaccines in under 12 months, achievements that have never before been seen in history. Let these lessons from the COVID response and the global solidarity and shared responsibility that have been forged also be the catalyst for a renewed global HIV response. I call upon Australia, with your immense scientific, programmatic, and country and community experience and technical know-how. You are in a good place to provide the regional leadership to energize the HIV response in Asia and the Pacific. Your response that prioritizes individuals and person-centeredness and that's rooted in a human rights framework can continue to be an example for the region. For both HIV and COVID-19, lasting progress will require addressing deep-seated structural inequalities to protect the most marginalized. We all know that this is no easy task and will require trust and collaboration, uniting scientists, policymakers, frontline health workers, and affected populations. On this World AIDS Day, on behalf of the IAS, I call upon the Australian and global community to address these challenges head-on. Innovation must include equity, science must inform policy, and community must be meaningfully engaged every step of the way. Thank you for having me.
Okay, I think it is just me to go on. Look, to Tim Wilson MP, to Senator Pratt, to all members of Parliament who are there, to Afeo and all our friends in the HIV world and many heroes of mine who are here. Thank you all for being here. My name's Brendan Crabb. I'm the Director of the Burnett Institute and the Chair of the Pacific Friends of Global Health, and welcome to my co-chair, Janice Reid, and who's also the former chair of the Pacific Friends. It's a great honour, very great honour for me to introduce Senator the Honourable Marise Payne, Minister for Foreign Affairs and Minister for Women. It would always be special to introduce the Foreign Minister, but particularly special to introduce someone who's made such a long and distinguished contribution to HIV and especially those most vulnerable of the people who are infected by HIV. It's a contribution, of course, that continues to this day in a very major way with her oversight, together with Minister Alex Hawke of the International Development Programme, that has long been just so important to the region's response to HIV. So it's definitely special, and it's special to do it on World AIDS Day. Minister, can I simply say it's how wonderful it's been to have the federal government step up so magnificently to support the region in recent months, especially assisting our neighbours deal with COVID-19. I know you and everyone here today appreciates just how crucial it is to do this, and to do it at the same time while keeping our eye on the other major global health challenges that are themselves, in my opinion at least, the crucial impediments to development, especially in the poorest regions. And of course, the top of the list there is HIV/AIDS. So indeed, it is quite the honour to introduce Senator the Honourable Minister Maurice Payne, Minister for Foreign Affairs. Minister. Who I hope is there.
Good morning, Brendan, and thank you very much for your warm introduction. I would like to begin by acknowledging the traditional owners and custodians of the very many lands on which we are meeting virtually today, and pay my respects to their elders past, present and emerging. It's always a great pleasure to address this distinguished gathering. The Australian Federation of AIDS Organisations, the National Association of People with HIV Australia, the Pacific Friends of Global Health, many other groups and distinguished leaders in the HIV response, and of course my parliamentary colleagues of the Parliamentary Friends group. Thank you so much, those of you who have been charged with the responsibility of making this happen despite the challenges of COVID-19 and social distancing. It does feel strange though, and I miss the opportunity to see so many of you here in person today. It also is an opportunity for me to acknowledge my parliamentary colleagues, my cabinet colleague, Greg Hunt, as well as Shadow Ministers Penny Wong and Chris Bowen. As we have observed in the past, this really is a cause and a focus that brings everyone together. The national theme for World AIDS Day this year is particularly apt, now more than ever. So much has changed since we met to mark World AIDS Day in 2019. And COVID-19 has unavoidably taken so much collective energy in 2020, and that does have the potential to threaten many of our hard-fought gains in other areas, including against HIV/AIDS. We know it's had a disproportionate impact on marginalised parts of the community, people with disability, women, and also exacerbated gender-based violence. And we also, unfortunately, know that the increased risk of HIV exposure linked to domestic violence is of concern. And in some places, we've seen resources diverted away from HIV/AIDS prevention and treatment. I think it's timely to remind ourselves today that HIV/AIDS was the pandemic of the 1980s in many ways. And now more than ever, it is important to reflect on the lessons and experience of the HIV response, and particularly the community-centred model that has been at its core. We can draw real strength from the simple fact that there are few communities more resilient and better prepared to combat a viral threat than those that live with HIV every day. These communities moved quickly to protect the most vulnerable and to harness their decades of experience and knowledge. They've met this colliding pandemic with dedication and innovation, embracing new ways of working and engaging. To each and every one of you, thank you. You're a big part of the progress we've made, and that Australia has been proud to support on reducing new HIV infections and the AIDS mortality rate. As Brendan has alluded to, Australia is a long-term supporter of global and regional action to combat HIV/AIDS. We're closely engaging UNAIDS on HIV prevention in our region and the next global AIDS strategy. And I'm very pleased to announce today that Australia will co-facilitate the upcoming UN General Assembly high-level meeting on HIV and AIDS with Namibia. The HIV/AIDS movement has a strong history of mobilising political engagement, and we look forward to continuing this tradition and working with Afeo and others to particularly support civil society engagement in this process and to emphasise the importance of community-centred response. Friends, civil society is also critical to the success of the Global Fund. The Australian government was proud to pledge $242 million for the 2019 replenishment of the Global Fund. And on the 14th of November, just a couple of weeks ago, the Prime Minister announced that the $24.2 million set aside from our contribution will be directed to provide technical assistance to countries in our region so that they are able to maximise the impacts of the Global Fund's investments, focusing on two critical areas of need: HIV prevention and strengthening of laboratories that are testing for HIV, TB and malaria, as well as COVID-19. Over the next 3 years, Australia will invest over $11.5 million to accelerate HIV prevention activities in the region at this critical juncture, including enhancing local capacity to scale up prevention for key populations. We want to make SDG 3.3 a reality. So, colleagues and friends, thank you for coming together in this virtual way this morning. And now, more than ever, we do need to keep our attention and our energy focused on this cause, and I look forward to continuing to being a part of that and to working with you all. Thank you very much for having us.
Thank you so much, Minister, and I couldn't agree more that a community-centred model is not only been the cornerstone of the HIV response, but it's as equally crucial to COVID-19, a lesson we're all still learning, I think. Despite how different the disease is, it is absolutely just as crucial. So thank you so much for reminding us of that. Now, it is my heartfelt, and I also hope diplomatic of me to say that it's as equally special for me to introduce our next speaker, Senator the Honourable Penny Wong, Shadow Minister for Foreign Affairs. And for very similar reasons, the Senator has long been an incredibly strong advocate against prejudice and discrimination, equity for women, for LGBTI citizens of the world, and for First Nations Australians, and of course also a long-time supporter of HIV in Australia and across the region and throughout the world. So it is indeed also an equally very special for me to introduce the Honourable Penny Wong, Shadow Minister for Foreign Affairs. Penny.
Thank you very much, Brendan, and thank you for the opportunity to be with you today. And I start by acknowledging that I speak to you from the lands of the Ngunnawal and Ngambri peoples and acknowledge them as the traditional custodians of this region. Can I acknowledge my parliamentary colleagues, particularly Tim and Lou, for their work as Chair and Deputy Chair of the Parliamentary Friends for Action on HIV/AIDS. But to all my parliamentary colleagues, the Foreign Minister, Mr Hunt, I think Chris Borne, Senator Rice and many, many others who are on the call. Can I say a particular democracy to Professor Adiba? That was really both inspiring and interesting address. And as a Sabahana, it was wonderful to hear you talking about community-centred responses. So thank you very much for that perspective. Thanks also to the Federation and the but most importantly to all of you here who have devoted your lives to the effort to overcome HIV/AIDS. It's good to see that this event continues with the sort of bipartisan support in a time where we've had a lot of partisanship in Australia, but this has been a matter that has continued to be bipartisan and something I know many of you appreciate. Well, as Brendan said, I've spoken at this breakfast a number of times. It offers us an opportunity to remember those we've lost and to celebrate those who are with us and to reflect on what we have learned and to be accountable, to look at how we're tracking again in our fight against HIV/AIDS. And of course, that's a fight from which we should not be distracted, even while we fight together a new and pandemic this year. And really, if we look at Australia's relative success in dealing with the challenge of COVID-19, in many ways it was grounded in the same principles that have guided us over the years in our fight against HIV/AIDS. Listening to the science, reducing risk of transmission, community engagement that elevates education over shame, access to services and treatment, and of course, striving for bipartisanship. And just as happened with HIV/AIDS, we have seen again with COVID-19 the risk that exists if there are political leaders who prioritise political point scoring over science and public health. So turning now to HIV/AIDS, obviously we have encouraging news, but we have more to do. Here in Australia, notifications continue to drop. 90% or more of people living with HIV are aware of their status. 89% of those diagnosed are receiving treatment, and 90% of those on treatment have an undetectable viral load. But regrettably, we do find ourselves in the same position as we were last year. The rate of diagnosis for our first Australians, Aboriginal and Torres Strait Islander people, is around double that of Australian-born non-Indigenous people, and the transmission amongst that community continues to rise. I'm afraid this is not the first time I've made this point at one of these breakfasts. Let it be the last, and let all of us, particularly members of the government today, commit to that. Speaking as the Shadow Foreign Minister, I again express my concern that progress in reducing new notifications has slowed in some countries across Asia and the Pacific, and indeed in some cases infections are on the rise. And there are some deeply troubling facts we have to address, including that more than half of the adults living with HIV in our region are not on treatment. Professor Adiba, I think, called in her opening address for Australia to demonstrate leadership in our region. I agree with her. Regrettably, some of our capacity to contribute has been constrained by the consistent reductions in budgeted amounts for official development assistance. And I again, as I did at the breakfast last year, offer Senator Payne my willingness to return to the bipartisanship on development assistance funding that we saw until 2013-14. Finally, I want to close on this point. As we look at some comparable countries who have struggled to manage the pandemic, we are reminded of how much we owe everyone in the field of public health. So I say to doctors, nurses, scientists, advocates and officials, we are greatly in your debt. We thank you so very much for your work and for your contribution to the Australian community. Thank you very much.
Thank you. I think it's over to me now. I'm Felicity Young, the recently elected president of Afeo. I would like to begin this morning by acknowledging the Jagera and Turrbal people, who are the traditional owners and custodians on the land on which I work. I would also like to pay respect to the elders, both past and present, and extend that respect to any First Nations people who are present here today. We meet today to reflect on the HIV epidemic and honour the memory of 33 million people who have died from HIV-related illnesses. Of course, another transmissible virus has disrupted our lives this year. But as with HIV, Australia has drawn on our courage, honesty and empathy to deal with COVID-19 as well as, if not better, than any nation in the world. Turning to HIV, the response in Australia was and continues to be community-led. As we have heard from the previous speakers, this has been one of our greatest strengths and something that we are very proud of. I would like to pay tribute this morning to our state and territory AIDS councils, particularly for the work that they have done this past year. Our colleagues who drive these organisations have climbed mountains this year. They've adjusted to telehealth and the difficulties of promoting HIV testing under social distancing, as well as dealing with profound anxiety and isolation experienced by many in our communities. Our community leaders and community members are heroes, and I warmly acknowledge their contribution. Similarly, across the Asia-Pacific region, the community organisations that Afeo has the real privilege to work with have shown themselves to be resilient and agile. The effects of COVID-19 have been profound, such as the disruption of drug supply and the loss of employment and accommodation. Despite these setbacks, our colleagues have found ways to adapt and overcome, continuing the important work of advocacy and HIV prevention, care and treatment. Our politicians, community leaders, academics, clinicians and government officials have been exceptional throughout the HIV pandemic. And we are fortunate that this is the same leadership that is guiding us through the COVID-19 pandemic. I would now like to introduce the Honourable Greg Hunt, Minister for Health. In the most turbulent of years, Minister Hunt has been a friend and ally of our mission. Despite the enormous pressure, and I can't possibly imagine what that must have been like, Minister Hunt has made himself available to Afeo, working closely and productively with us on a range of major developments in the HIV response. We are truly fortunate to have a minister who actively supports new HIV technologies such as PrEP and self-testing. Minister Hunt, it is a pleasure to introduce you.
Oh, look, thanks very much to Felicity. And I really think what you said is a very powerful statement about community-driven responses to health crises. And obviously this year, more than any other, as a nation, we've lived through the most significant health crisis since the Spanish flu. But we've also lived a crisis which could have been a catastrophe over 35 years now with HIV. And Afeo's leadership, yourself and Daryl and all of those thousands of community leaders and health professionals and medical workers across the country have contributed to that change. And whether it's Scott and Aaron from NAPWHA, Michelle and Indigenous Australia, and I particularly want to acknowledge you, Michelle, as a representative of Indigenous Australia and as a leader, where I think arguably we have our greatest HIV challenge in terms of this now more than ever theme. Parliamentary colleagues, Tim and Louise, Maurice, Penny, my counterpart, Chris Bowen, and to everybody who's here today, but a special shout out to Professor Adiba for your work within the region and your international leadership. So our journey, we know that our goal is a very clear goal, and that's effective elimination of HIV in Australia. We know that there are 28,000 people approximately living with HIV in Australia, and just over 800, I think 833 notifications in the last 12 months. And at the same time, we've seen a 23% drop in cases over the last 5 years. And that's been driven by medicine, behaviour, awareness, education, and perhaps above all else, support. Support so as people can be tested without stigma, that they can be treated without stigma, they can live without stigma. And that's a collective outcome. And this is something which has been a bipartisan, a multi-partisan, a community-wide commitment for 3.5 decades. Beyond that, with that progress, this year's been a very interesting year. Obviously, we've all lived through the pandemic, and it could have been a catastrophic year for advancing HIV treatment, awareness, support, and there have been difficulties. But at the same time, the pandemic response has actually facilitated long-term transition. We now have, exactly as Felicity said, telehealth, over 40 million consultations. It's a decade-long change in Medicare delivered in 10 days, and it will assist us reach people in remote and rural and regional communities to assist with HIV and other treatments. And so that's a transformative change. Similarly, e-prescriptions. Today, South Australia signs on to e-prescriptions. It's expanding around the country, and it should be in all parts of the country by the end of March, a transformative moment, particularly for those who are housebound or otherwise unable to visit the doctor. And with e-prescriptions, we also have continuous delivery and home delivery. So telehealth, e-prescriptions, continuous delivery, home delivery of medicines. All of these things are about supporting those that, for whatever reason, are suffering from lack of mobility and the inability to visit the doctor or the pharmacist. They're permanent changes which have come about from a moment in time's necessity. And that's a great Australian adaptiveness, which has a benefit for HIV and for people with other communicable diseases, as well as other forms of immobility. So it's a really profound moment. So then let me turn to the future. And today I'm privileged to be able to announce $6.15 million of federal funding for HIV awareness, treatment, promotion within Australia. In particular, as part of that, there's 1.5 million for Afeo and NAPWHA for workforce support. This work that you do deserves to be supported in supporting the workers, the carers, the medical and health professionals in our urban and our rural and remote areas. It also includes 750,000 for illicit drug use and the work of so many on that front. We know this is still in this day and age a source of transmission. But perhaps most significantly, there are two further initiatives. One is the listing of a new medicine. 2 years ago, we listed PrEP. Today, we're listing Dovato, an antiretroviral that will help 28,000 people save up to $8,500 a year, but it gives them better treatments and more options. And this is part of the battle to win this fight against HIV, which we will do. And that was impossible 3.5 decades ago. It was impossible. Finally, though, something which many of you have campaigned for, we are now in the process of completing agreements with all of the states and territories for access to Medicare for people from overseas who have HIV. And that's about protecting them, and it's about protecting the rest of the community. It's the right thing to do, and it's the smart thing to do. And I particularly want to acknowledge Tim and Louise, Afeo, for having put this case forward, and we're now progressing it. We've made the decision as a government to do this, and we'll need your help to encourage some of the states and territories, but ultimately we'll deliver Medicare support for every person that's in Australia with HIV. And I want to thank you and honour you for your commitment, because as the theme says, now more than ever is that moment for that last reach to achieve the goal of effective elimination on World HIV/AIDS Day today.
Thank you, Minister Hunt. I would also like to sincerely thank you for those announcements today, and we are delighted to hear that a solution has been put forward to bring life-saving treatments to all people living with HIV in Australia. I would actually like to give the credit to NAPWHA for this initiative, because our colleagues at NAPWHA have worked for the past 2 decades to come up with a solution for that. So thank you, NAPWHA, and thank you, Minister Hunt. One of the foundation stones of Australia's successful HIV response, which we've heard this morning, is something we're all very proud of and we hold it dear, which is our non-partisan political commitment. Its origins go back to the legendary working partnership forged by Dr. Neil Blewett and Dr. Peter Borne in the 1980s, despite being on opposite sides of the Parliament. We are indebted to their leadership and the countless lives that it has saved. Each of you here today, from all sides of politics, forms an unbroken line of political leaders on whose shoulders rests the responsibility for continuing that legacy. And we thank you for that. As we step towards a federal election year, there is a naturally heightened interest in the vision of the alternative government. I am delighted to introduce our next speaker, Mr. Chris Bowen, Labor's engaged and committed Shadow Health Minister. In his reply in October to the federal budget, Mr. Bowen placed preventive health at the centre of health reform. It is a lesson writ large by COVID-19, and one we hope will lead us to end HIV transmission. Shadow Minister for Health, Mr. Chris Bowen.
Thank you very much, Felicity, for that lovely introduction. And I also want to acknowledge the fact that I join you from Ngunnawal and Ngambri land and pay my respects to their elders past and present and emerging, and also the elders of the lands from everywhere, which we're gathering around this morning. And importantly, as we do so, not just acknowledge in continuing Indigenous culture, but also acknowledge the fact that we will not meet the target of elimination of HIV/AIDS community transmission in Australia by 2022 unless we eliminate it in our Indigenous communities where actually diagnosis rates are on the rise and are double those of non-Indigenous Australians, and that is an integral part of tackling HIV/AIDS in Australia. Well, as other speakers have said, today is an opportunity to celebrate the success so far in Australia, which is, as others have said, a recognition of the strong community leadership led primarily by the groups that make up Afeo, the focus on prevention and the focus on science in relation to PrEP, which provides, again, evidence for other pandemics and other medical challenges in Australia, and also the remarkable run of bipartisanship in Australia, which now stretches to 4 decades. In an era of arguably our most partisan part of our political history, an era of hyperpartisanship, it is actually a remarkable achievement that we've kept 4 decades of bipartisan commitment to tackling this most insidious disease. But of course, it's not just about celebration, it's also about recommitment. We did miss the 2020 target. We have to acknowledge that. We have to acknowledge the fact we've reset the target for 2022, which is not far away, and it would be unconscionable not to meet that target. And it's important to note that it's difficult to say we are currently on track to meet it, but of course, everything possible that can be done must be done to meet that target. We're 95% of the way there, but as we say sometimes in relation to negotiations, if you're 95% of the way there, that means you're about halfway done, because the last 5% will be by far the most difficult. But we can do it, and I think the COVID crisis has reminded us of just what is possible when Australians turn their mind to something, when governments of all persuasions focus on a problem, work together with a laser-like focus and don't accept that it's too hard. We've done that this year, whether it is flattening the curve of COVID or increasing our capacity. When you think that in February, Australia had 2,000 intensive care beds across the country, and now we have 7,000. And that's a remarkable achievement with credit for all involved, federal, state, and everyone. It shows what is possible, and we should not accept that things that have been in the too hard basket for decades are too hard when governments actually have that commitment. And they should go from the too hard basket to the to-do list, and clearly eliminating HIV/AIDS community transmission in Australia must be on our to-do list. In keeping with that bipartisanship, I very much warmly welcome the commitments by the Minister. We warmly welcome and agree the funding commitment by the Minister today. We fully endorse the extension of Medicare to overseas people in Australia. It's an integral part of the commitment that has our full bipartisan support, as will anything else which is necessary to eliminate HIV/AIDS transmission in Australia. So this is an important breakfast of many years standing. It was important that it continue this year in very different circumstances, but continue it has. It has with the same level of engagement and involvement from this building as is appropriate, and I'm sure will continue to do until that breakfast in 2023, when we can celebrate having met the 2022 target, and it will be a very good day indeed. So thank you to all who worked so hard to get there. We're almost there, but we must ensure we actually complete the job. Thanks for having us here this morning.
Mr. Bowen, thank you, and also thank you for your ongoing support of the national HIV response. Minister Hunt, thank you for your commitments today, particularly in relation to Medicare, but also your commitment to the development of the national community workforce. First, let me acknowledge I'm on the lands of the Bundjalung people in far north New South Wales. Minister Hunt, esteemed colleagues, supporters and fellow people living with HIV, this is a great moment. For years, the treatment and care needs of those of us in Australia without access to Medicare has been a constant and major concern for my organisation, the National Association of People with HIV Australia. It has been for all our community organisations, for HIV clinicians and their staff, for the pharmaceutical companies who provide compassionate access to their drugs, and particularly for the individuals and their loved ones who find themselves in this situation. So NAPWHA warmly welcomes the Minister's intent to work with his state and territory colleagues to address this gap in treatment access by the end of the financial year. I thank the Minister for his vision and his leadership, and I also want to thank the Parliamentary Friends group on HIV for their support as well. While we understand that there is still much work to be done and processes still to be undertaken, I can confirm today that NAPWHA and the board that I lead is committed to working with the Minister and state and territory governments to do whatever we can to ensure this agreement is completed and successfully implemented. Such a national partnership, as outlined in the National HIV Strategy, is something that we at NAPWHA have up until now only dreamed about. It will bring us another step closer to becoming the first country in the world to end HIV transmissions, but is also important for many other reasons. It demonstrates compassion for all those people living with HIV on our soil. It reinforces Australia's leadership in this space and sets the example of how society should respond to HIV. It also solidifies a commitment by our governments to fast track global targets to end the HIV epidemic. That means 95% of people living with HIV knowing their status, 95% on treatment, and 95% with an undetectable viral load. The latter, having an undetectable viral load, is, as we know, the prerequisite for U equals U, or undetectable equals untransmittable. U equals U is another international movement that people with HIV in this country have embraced. We treat to live better and longer lives. We treat to protect those we love. And now more than ever, this is possible for all of us. From NAPWHA and all people living with HIV in Australia, thank you for staying the course, and we wish you a very happy World AIDS Day. Thank you.
Thank you very much, Scott. It's a great pleasure as Tim's co-convener to be able to close this morning's proceedings. I want to say thank you to all of our speakers this morning, in particular, Michelle and Scott. As people living with HIV/AIDS, your visibility and advocacy is critically important. I remember at one of these World AIDS Day breakfasts, the issue of Medicare treatment and Medicare lack of access for people living with HIV coming up as a topic. And indeed, I pay tribute to your advocacy. And just as we've seen, Michelle, I really want to pay tribute to your remarks, because we know First Nations communities are much more vulnerable to transmission, often because they don't have access to the same level of resources, in terms of resources that are bespoke to community needs. And just as we've seen with COVID, we know that communities can be more vulnerable when they don't have access to language and things that are culturally appropriate. Which takes me to the government's wonderful announcement from Senator Payne that we will be co-hosting with Namibia the next UN high-level meeting. I was around, and I'm sure some of you might also have been around, when Australia last co-hosted that meeting with Namibia. And one of the things that Australia fought hard for, and did so very successfully with Namibia in negotiating, was getting the language to make sure that sex workers, men who have sex with men, transgender people, had visibility within that statement. And as Adiba's comments today really highlight, we know that without inclusion of all communities, that people can be left behind in the response to the HIV pandemic. She highlighted for us the vulnerabilities of nations around our region in their own response to HIV/AIDS, and paid tribute to Australia's own response in terms of working with affected communities. Nevertheless, Adiba did remind us that Australia has not 100% compliant with all of the things that need to be done to remove stigma, discrimination, to make sure that people have proper access to treatment and prevention. There's still a great need for law reform around the country that prevents that discrimination and stigma. I want to say thank you to both Greg and Chris, and indeed, as has been highlighted, that deep engagement with government to make progress on things like testing and treatment and PrEP. You know, again, I remember discussion where the idea of being able to test yourself and test your partner was immensely controversial, and communities really pushed government to say, we can do this and it will make a difference. Penny and Maurice, thank you very much for your vision and advocacy and global work and global commitments in this space. And a big shout out to my special friends in Brendan Crabb and Felicity. Thank you for sharing your leadership with this event today. And finally, to my good friend Tim Wilson, thank you for always keeping this on the agenda. We've got a great and a long history, so we've been able to put on this less than traditional World AIDS Day breakfast this morning. And we've been joined by a great many parliamentary colleagues, and we really appreciate you being part of this journey with us. I know from my own experience that you do get to see by your attendance at this event the enormous milestones that we reach as a nation in addressing HIV AIDS both here and globally. So thank you, everybody. And thank you to Afeo for your wonderful hosting, and to all our all our sponsors.